All right, so now that we've talked about our osteology and our muscles, I want to tell you guys a little bit about the nerves that are going to innervate those muscles that Alex talked to us about. All right, can everyone see my screen? Good, okay. So I wanted to start by doing a little bit of a review and kind of tying together the big picture because that helps me to kind of get organized, and I always want to know like where that nerve is coming from to understand why it's innervating the muscle that it's innervating. So I kind of jotted down the big topics that we want to think about in this gluteal and posterior thigh region. So lumbar plexus is one of them, sacral plexus is going to be a big one, and then sciatic nerve. So I have two questions for you guys to kind of think about before we move on to the next slide. So the first one is, who remembers the acronym for the lumbar plexus? And then what are the two main branches off of the sciatic nerve? So you can pause and kind of think about this before I show you guys the answers. All right, so for lumbar plexus, it was at I Get Loud on Friday. And you guys can kind of look through, I've just kind of grouped together the nerves and the roots. And this isn't specifically related to the gluteal region, but I included it just because it does, kind of come off before our sacral plexus. So for those of you who just wanted a little review, and it is relevant to our anterior and medial thigh group. So I'll leave that there for you guys to look at. But what we're more concerned with in this region is the sacral plexus. So we have our lumbosacral trunk, superior and inferior gluteal nerves, posterior femoral cutaneous nerve, pudendal nerve, and then sciatic. And I've put stars next to the ones that are specifically related to our gluteal muscles and our posterior thigh hamstring muscles. So the sciatic nerve is going to be a big one, branching into our main tibial nerve and common fibular nerve, which can also be called perineal. So our anterior leg and lateral leg group did a really good job of showing us those branches of the sciatic nerve kind of further down the chain. So I'm just going to talk to you guys a little bit about what it does kind of at the top of the chain. So this is just a visual of those nerves I just listed. So you can see the superior and inferior gluteal nerves up at the top, and you can see them going directly to that posterior surface of the ilium, which we learned from Zach and Alex, that are going to kind of hold those insertion and origin points for our glute muscles. So we can imagine the glute med being here, the glute min, and then the superficial glute max. And as we follow kind of further down the chain, you can see our giant sciatic nerve, and we can imagine that our hamstring muscles will be here getting innervated by that nerve. And then a little bit further down, we can see those two main branches, tibial and common fibular. So for those of us who like the words and lists, I've just kind of grouped together the nerves and listed off the muscles innervated by that nerve. So starting with superior gluteal nerve, we can see it innervates the glute med, glute min, and our TFL, or tensor fasciae latae. And then our superficial and kind of bigger gluteal muscle, the glute max, has its own nerve, inferior gluteal. And then all of our deep gluteal muscles can kind of be grouped together, which is nice for study purposes. All of those muscles are going to be innervated by a more broad sacral plexus, which I'll kind of dive into a little bit more for those of you who want to understand that. But as far as studying goes, we just kind of have to know that the sacral plexus innervates those muscles. And we can remember Those deep ones are the piriformis, quadratus femoris, gemellus superior and inferior, and then the obturator internus. And then our giant sciatic nerve is going to innervate all of our hamstring muscles. So we have that semimembranosus, semitendinosus, and biceps femoris, all getting innervated by the tibial branch of the sciatic nerve. But don't forget that the biceps femoris does have two heads. The long head is going to be innervated by that tibial branch, but the short head is innervated by the common fibular or peroneal branch of the sciatic nerve. And then I also included a note for that adductor magnus muscle. We don't want to forget that that also has a hamstring part. So that hamstring portion of that muscle is going to be innervated by the tibial branch of the sciatic nerve as well. All right, so I think this picture does a really good job of depicting the nerves and which muscles they're diving into. So it really helps me to see a visual. So we can start by identifying the piriformis muscle, which is a good guide for identifying other muscles as well as these nerves. So if we want to start superiorly, we have the superior gluteal nerve. And you can see, although it's cut away, you can see it color-coded on the right. You can see that that superior gluteal nerve has branches diving directly into that glute med muscle, which is colored in green here. And it also kind of lies directly on top and goes into that glute min muscle. And then looking at our piriformis again, if you go below it, you have your inferior gluteal nerve going directly into that glute max muscle that's colored here on the right in red. Then our last nerve is going to be the sciatic nerve coming directly from underneath that piriformis. It's significantly larger than some of our other nerves in this region. And you can see it kind of diving down and going further down the chain, which is where we would find our hamstring muscles. So question for you guys to think about, can you recall the deep gluteal nerves of the sacral plexus? So we know that study-wise we can think of the sacral plexus innervating all of our deep gluteal muscles, but for those of you who want a little bit more detail and understanding as to which specific nerves are innervating those muscles, I've created a little chart here that's color-coded. So you can read these off. Sciatic, posterior cutaneous, superior gluteal and inferior gluteal, nerve to quadratus femoris, pudendal, and nerve to obturator internus. And then to kind of relate this to our lecture, through which structure do these nerves leave the pelvis? It's going to be that greater sciatic foramen. And then this picture is just kind of showing you the different variations of the sciatic nerve in relation to that piriformis muscle. So on the left here, it shows you that most textbook version of how the sciatic nerve is relating to the piriformis, and that's most likely going to be coming from under the piriformis and traveling further downstream. But the picture on the right kind of shows you the different variations because, you know, as we've seen in lab, each cadaver is oriented differently, and there can be those variations. So you can just see that it could be diving directly through, it could be above, it could have several branches. So yeah, that's just showing you that it's not always going to be that textbook example. And then this picture is kind of similar to the one I showed earlier, but just kind kind of shows the further downstream what you have going on there as far as the hamstring muscles. And specifically, we don't want to forget about the biceps femoris, which does have those two heads. And you can see the long head that would get innervated by that tibial branch. And then the short head, we can see it originating and inserting a little bit more laterally than the long head. So we can connect that and realize that it's going to be innervated by the common fibular branch of the sciatic nerve. All right, that's all I have for you guys for nerves. I'm going to give it over to Jada for arteries and veins.
Sorry, y'all. Okay. So now we're going to get into the arteries and veins of the gluteal region and the posterior thigh. So I chose these two pictures because they're pretty more extensive pictures of all of the arteries and veins in this region. Like Hannah said, you can see the relationship here with the piriformis and the superior gluteal and inferior gluteal. So piriformis is a great reference point for that. All right, so the arterial supply of the gluteal region. So most of these arteries are coming from the anterior and posterior division of the internal iliac artery. The important arteries of this region are superior gluteal, which you can see here, inferior gluteal, oops, sorry y'all, internal pudendal artery and the obturator artery, which aren't shown in this picture, but you can imagine where they would come from in the anterior division. The superior gluteal artery is going to supply the gluteus maximus, gluteus medius, gluteus minimus, and the TFL, or the tensor fascia lata. Inferior gluteal, gluteus maximus, piriformis, quadratus femoris, biceps femoris. Internal pudendal artery is going to supply the piriformis, obturator internus, and gemellus superior. And the obturator artery is going to supply obturator internus and externus. The arterial supply of the posterior thigh. So these arteries come from the external iliac artery, which is going to come under the inguinal ligament and come down towards the femur mostly. You're going to have a branch of the profunda femoris, or the deep femoral artery, which is going to break into the medial and lateral circumflex femoral, and then the perforating arteries. And then, of course, the femoral comes down and continues into popliteal, but that's not really our region. The important arteries of this area are the medial femoral circumflex, which supplies quadratus femoris, gemellus inferior, obturator externus, and all of the posterior thigh. And then the perforating arteries, which supply semitendinosus and semimembranosus. So now I'm going to go to complete anatomy, where everything here is greatly laid out. So as you can see, you can use your ligaments here, so the sacrotuberous and sacrospinous, to see the greater sciatic foramen, which is where most of the arteries are going to go through, along with those nerves Hannah was talking about. So in the posterior division, here's your superior gluteal. Oops, sorry, not that one. This one. This is your superior gluteal going under the greater sciatic notch. And then on this side, you can see it better fanning out on the gluteal surface. And you can imagine that it would supply all of those muscles in this region, which are here. And then here you can see your inferior gluteal, which is also going through the greater sciatic foramen and down to supply some muscles of the posterior thigh and gluteal region. And then here is your external iliac, which is coming down into femoral and then branching into the profunda femoris, and then the lateral femoral circumflex, and then the perforating arteries. Oops, it's not clear. Sorry, y'all. There we go. Which on this side, you can see where it would supply the posterior region of the thigh. Up here, I have it with the relationship with the nerve as well, so that you can see that the superior gluteal dives under the lumbosacral trunk, and the inferior gluteal dives between S2 and S3. And then also something else I wanted to show again was that relationship with the piriformis, which you see here, that it also has with the arteries as well as the nerves. All right. So now I just want you to take a second, do a brain dump. I'm gonna give you some time, trace the flow of blood from the left ventricle to the posterior thigh and the gluteal region. And you can be as specific as you want, as vague as you want, just see if you can trace it all the way from there to where we are now. I'm gonna give you like 10, 15 seconds. And you can pause the video also if you would rather do that. Okay, so after you do this, I encourage you to use Complete Anatomy or the textbook to trace your answers and make sure that they're correct. And if they're not, you may need to spend more time with the material just to make sure that you have it down. So next, we're going to talk about the veins of the gluteal region and the posterior thigh. And the great thing about the veins of this region is that they all have the same exact name as the arterial supply. So if you know the arteries, you know your veins. So superior gluteal vein runs with superior gluteal artery, so on and so forth. I'm not going to spend a lot of time on this because remember, we just admire the veins and we move on. So now I have this video of the overview of the, okay. It's an overview of the lower limb arteries. And we're just gonna watch a little bit of it. Okay, so actually we're just, if it's okay, you can watch it on your own time. And it just gives you a great overview of the arteries from the aorta all the way down to the leg. And then I also put the Michigan University practice questions in here. This is more lecture based, but it's a great way to test your knowledge of the landmarks, the material, and where arteries go and what they supply. And that is the end of our presentation. Thank you so much for coming and watching. Does anybody have anything they want to say?
Yeah, so I mean, if y'all have any questions or anything watching this, reach out to us. We'll try our best to clarify or, touch up any information that might need to be touched up. So just let us know. Anybody else want to add anything?
Thanks, guys, for watching.
Yeah, thanks. Oh, we have a discussion board thing, don't we? That's where they ask their questions.
Yeah. Mm-hmm.
Okay.
Yeah. So happy studying, everybody. Let's stop the recording.